Executive Director for the National Organization of State Offices of Rural Health, and I have the pleasure of wishing you a happy National Rural Health Day. Before we begin, I have a couple of quick housekeeping items for you. First, we want you to know that this session is being recorded, and for that purpose, all phone lines are muted. We hope that you will have questions and comments, and we ask you to please click on the circle at the bottom of your screen that looks like a conversation bubble for chat, and enter your questions, your comments, and your discussion items in the chat box that will pop up on the right-hand side of the screen, and we'll use those for interacting with Andy. Finally, I'd like you to know that the recording will be available on the NOSORH website by early next week under the past webinar materials tab. So as we plan this conversation this afternoon, we are always looking for issues that are important to rural America, and certainly EMS is an important part of ensuring access to care for rural communities across the nation. State offices of rural health, state EMS officials are working together with local and regional partners to improve rural EMS, and we do this work in conjunction with many national and state partners. Today, I'm really happy that we get to spend some time with Andy Gienap. Andy is currently the EMS manager for the Wyoming Office of Emergency Medical Services. He's a paramedic with over 28 years of emergency medical services experience. He's an active member of the National Association of State EMS Officials, and he's co-chair of the Joint Committee on Rural Emergency Care. He's a gubernatorial appointee to the Serve Wyoming Commission and a 24-year veteran of the U.S. Army Medical Department. His service there has included 2 tours of duty in the Iraq Theater. He holds a Master of Science in Emergency Health Services from the University of Maryland in Baltimore County. Andy, I thank you for joining me today. Every time I get to spend some time with you, whether it be at one of our EMS conferences or on a committee call or at our annual meeting, I learn so much from the work that you do. So let's dive in. Beth, the next slide, please. Andy, I would like to start out just by talking to you about the power of rural. And when you think about the power of rural, what comes to your mind and why is this important to you?
Well, thank you for having me on today, Terrell. I truly appreciate it, and I've always enjoyed working with all of you there at NOSORH. You know, there's an inescapable draw to rural communities. If you, many people, most of us live here by choice because we enjoy being in rural America. So, you know, the lure of our rural and frontier areas within the nation is pretty inescapable. So that certainly is a power. There's a unique power in that it manages to hold people here. Of course, there's many of us that grew up in rural areas, and you either seek that or you choose to stay there, as opposed to living in the more urban areas of our country. But I think that ultimately it, you know, obviously that creates that power creates challenges, and it also runs deeper than that. It's not simply about making the choice of, do I want to live in a really pretty country and remote part of the nation or a particular state, but the rural areas, there's a bedrock there that are absolutely vital to our nation, particularly economically. When you consider that our rural states, our rural areas, are where we get most of our natural resources are coming out of these areas. The food production and agriculture that are so important to feeding the nation come from our rural states. It's a huge draw in terms of tourism. So I think these are some of the particular things that we all know contribute to the culture of our nation and what we mean with 50 states and 6 territories combined. So that's it. And along with all of that comes a lot of unique challenges and opportunities. So I think those are probably the biggest things that come to my mind.
Thanks, Andy. I mean, I really love what you said. We do have some stereotypes about rural America, but I do think that people choose to live there because it's a beautiful place to be, and there are some great jobs in rural America, and we want people to understand that health professionals can have good careers there as well. So I love that you weren't really talking about EMS and ambulances and public safety and those kinds of things as you talked about Power of Rural, but I know you to be a real rural EMS expert. And I'd like to know, not that we have all day, I think we could talk to you for all day or maybe a week. What do you want people to know and to understand about rural emergency medical services?
Well, Carol, you certainly know me well enough to know I could go on for hours about this, so it's hard to boil it down. But I think and on Sunday I will head to Texas to speak to their state EMS conference on exactly this topic about what's going on in rural EMS. And I think the easiest and simplest way to synopsize this for everyone is to say that rural EMS is in the midst of change. It's an exciting change, and we have an opportunity right now to create something that's revolutionary and really build a solid future. But that's about having the right conversation. So that's an important twist to the concept of rural EMS and rural healthcare is at a crisis point. It's easy for us to get lost in the headlines related to ambulance services and critical access hospitals closing, but it's much harder to see through to the end to see what that future might hold. And there's an old saying, an old axiom, never waste a good crisis, and that's kind of where I think we are right now, because certainly as it relates to rural EMS, on the surface it seems to be about the loss of volunteers, but underneath it really is about how rural EMS and EMS in general is viewed and valued and funded and structured, and that's the much bigger part. So we're at a unique point. We're at a point right now where we have the opportunity to build something significant and sustainable for the future, but that's all dependent on us having the right conversation. And I would say that if we don't get serious about that, then Terrell and I will be having this conversation after both of us have retired, going, wow, nobody has fixed rural EMS yet. So I guess that's the takeaway. Yes, we have problems, but we have to have the real conversation about how we value, fund, structure, and plan for EMS, and we have to be deliberate about it, and we got to do it now. Otherwise, we're just going to continue to watch headlines scroll across the screen.
Yeah. Andy, this isn't on your list of questions, but I wonder if you could talk about your, kind of your top 3 changes that you see, or maybe we'll address that with, that EMS tactical agenda. What kind of, when you're talking about that and focusing on a positive future, you want to talk about that a little bit, or could you expound on that for us? Sure.
Yeah, and when you have to go a little bit deeper into what the problem is, but I don't want to take us down that rabbit hole too far. Right. But the essential problem is that EMS in general, no matter whether it's an urban or a rural area, was never supposed to be what it is today. And that was particularly true in the rural areas. And in what we are finding out, or what communities are finding out right now, is that what they managed to survive on for the last 40 years doesn't work for the future. But the exciting part, the exciting part about that, as you looked at what changes are out there, I think we are finally seeing a lot more engagement and a lot of understanding about what's actually occurring with rural EMS. You know, I was involved in the 2050 project, and those folks that worked on that with me were very attuned to it. Everywhere we went across the country, it seemed like people were finally paying attention. I think we're starting to see the development of sustainable business models that offer a little hope. There's, of course, the concept of community paramedicine, which is still trying to get its full traction in rural America. And all of those things are important because I think for many years, and it's still going on right now, but I think for many years as communities looked around and they saw, as they've seen their local EMS kind of teetering on the edge of sustainability, they've been at a loss because they don't know how they could possibly do anything else. It's difficult for them to conceive of what a future or what a difference might be, but you know, there's a lot of good work going on in local areas and at a national level that I think are starting to help turn the tide, or at least offer us a vision of what else could be done.
Absolutely. Yeah, and you're a big part of that. You know, on National Rural Health Day and throughout the year with our Power of Rural movement, we ask everyone to take the Power of Rural pledge. We believe that the best way to address rural issues and to spotlight everything that's positive is important. So we ask people to pledge to communicate, to educate, to innovate, and to collaborate. Andy, could you maybe share some examples about how these actions, if you will, are important to rural EMS and what you've seen, you know, maybe a little bit about what you've seen come from that? How does that guide or not guide your work?
Well, so what I think has not been done consistently, and part of what got us to this, part of what has gotten us to this point is is not communicating, for sure. You know, I have some good friends of mine, John Becknell and Aaron Reinert, who will tell you that, you know, one of the things that leaders do well, no matter what organization they're in, is that they tell a compelling story about what's going on. And so I think that's one of the areas that we're doing a lot better at, and that more needs to occur. So when you see efforts occurring out of numerous sources, like the Rural Health Information Hub, the National Rural EMS Conference that NOSORH and the SEMSO helped to kind of launch, that's part of that, of beginning to tell a compelling story. You know, on the idea of collaboration, I think that's where we're seeing the most successful and most hopeful business models, is when you see the local system that's able to take EMS, for example, and combine it with the local critical access hospital. That's an important relationship that you and I, and certainly the late Tom Nearing and I had discussed at length, was the importance of that work together. Because if EMS continues to, and the hospitals for that matter, if EMS continues to exist in its own silo, and believing that what they do or don't do doesn't necessarily impact that local hospital, or conversely, if the local hospital is not able to impact, affect, or see how the impacts are of local EMS, what those are as it relates to the hospital, if you can continue like that, then there is no hope. Your model is dead and over with. But in those areas where we have seen some of those stark examples where things have started to change and turn around, it's because of that collaboration. So those would be two that I would point to immediately.
Yeah, I appreciate that. I mean, I think there's probably a story for every successful service across the country, even the ones that where there are problems. There are still lessons to be learned there. So it's That's fantastic. Anna, you co-chair that Joint Committee on Rural Emergency Care, which with Joyce Hospodar from the Arizona Center for Rural Health. And as a rural leader for the National Association of State EMS Officials, you kind of go back and forth with us, and NOSORH go back and forth about that. We're really proud of that work that we do together on the Joint Committee on Rural Emergency Care. We know that we all bring different aspects of this work to the table, and I'd like you, if you could, talk a little bit about this effort that the Joint Committee on Rural Emergency Care is working with Kevin McGinnis, who's leading a new effort to develop a rural EMS tactical agenda for the future. I think there's been a nice vision for that being tactical. Could you talk about that effort a little bit and what priorities you think will be important for EMS that will, come from that report, and how you think that might be used?
Sure. So there were the hallmark document that spurred a lot of change across EMS across the nation was the 1996 EMS Agenda for the Future. And that document gave birth to several other agendas that kind of drilled down into more specific areas. So, for example, out of that came the EMS Education Agenda for the Future, the Research Agenda, several other documents along there. And one of those was the Rural and Frontier EMS Agenda for the Future, which was an attempt to focus in on the things that were going to be very vital for rural and frontier EMS in the coming years. So that document is well over 10 years, almost 15 years old now, the Rural and Frontier EMS Agenda. So there were lots of, and you mentioned Kevin McGinnis, who has absolutely been a leader in rural EMS for years predating me, without a doubt.
I'd use the word rock star.
Yeah, it's kind of like when you say community paramedicine, all roads lead to Gary Wingrove, and when you say rural EMS, all roads lead back to Kevin McGinnis at some point. But he was kind of the inspiration and the principal investigator and writer behind that document. And as that document has aged, coming back into it and saying, well, we see the move out of NHTSA to update the agenda for the future. That document will then be released now as EMS Agenda 2050. And then but we took a different approach with the Rural and Frontier Agenda. Rather than creating a new one, the concept was, how can we go back into this, see what's still relevant, and focus down on a couple of things that we need to flesh out of that. So some of the things that I think you're going to see is prioritized out of that, more related to studying the particular aspects that are affecting and impacting rural EMS. For example, reimbursement from both CMS and other third parties. How do you build sustainable systems? We've talked a lot about the concept of informed self-determination, which is how a community makes a determination about what type and what level of EMS is going to work for them. So I think those are some of the big ones that I would point to that you're going to see out of that, and making the data and information relevant in actually designing rural EMS systems rather than the laissez-faire approach that we've taken up to this point.
Right. I mean, I think I've heard you talk about, and I in my work in rural health, I can remember probably 20 years ago, EMS agencies wanting to be you call, we haul kind of thing. And there's a huge evolvement there. You've been talking about that all this afternoon. I love the work about informed community self-determination. And that is about communities understanding that they have a range of what they want to call EMS and what does that mean. And I think it's fantastic that, you know, we'll be helping to shape that work. There are many state offices of rural health around the country who are doing that. You can see some of those state offices, Sarah Craig in South Carolina posting some resources, and Matt Stricker is over there on the chat around community paramedicine, around new payment methods and other things that we've been talking about at our conferences. I would like to take a little break. Matt or Beth, is there a question in the chat that maybe went to the host that you would like to share with us?
Yeah, I've got a question from one of our participants for Andy. The question is, do you find it to be a huge challenge of rural EMS, being that it's based on volunteers? Urban services seem to be better funded, and also access to patients being more difficult in rural areas. Are there changes being proposed about that?
So
that's a three-part question.
Yeah, I know. Let me take on the volunteer thing first, Matt, and then I'll probably need you to restate the other two. Well, now I've talked and I don't remember what the exact part of the volunteer was. Can you just read that?
Do you find that it's a huge challenge of rural EMS, being that it's based on volunteers?
Yes, and here's the reason why: is that for 40 years, the communities who have had active participant volunteers have not been, the real cost of providing EMS have been hidden by the fact that they had volunteers. Almost without fail, in any organization, you know, the highest amount of overhead that you have is the personnel, the labor. And that labor has been donated to the communities for the last 30 to 40 years. And it has only been within that's difficult to see. And so what the community experiences as the volunteers have drifted away and have not been replaced, what the community is being forced to confront is, well, with no one volunteering here to do this, how do we do this? So the costs, in a sense, haven't really changed. They were always there. It's just that they were being absorbed by the volunteers. And so I think the difficulty has been, and the hard conversation to have is with the community, is to say, you know, especially with the way that EMS has evolved across the years, nobody really saw it happening the way that it has, and nobody anticipated where we are today. And so we were ill prepared as the volunteers drifted away and are gone. We were ill prepared to take that on. In the urban communities where they had their hand kind of forced on it early, and it's much more assumed that they have to allocate to that. And so that's where I think the communities now and EMS agencies are feeling kind of lost, is because they're not quite sure what solutions can be done, and they look around and say, well, we can't afford this. Well, that's where the concept of informed self-determination comes in, which is to say there may be many models that are acceptable, but you, the community, need to decide what it is that you want and what you're willing to pay for in order to make that happen. Go on with the other parts, Matt. What were the other parts of the question?
You kind of answered that next part where you said urban services seem to be better funded, and they kind of asked, you know, access to patients are more difficult in rural areas. And I think you kind of touched on that. Their question was, are there any changes being proposed? But I think with the access part, I'll let you talk about that, though.
Yeah, so, you know, this is a really, really hard conversation. In most rural communities, when you're talking about volunteer ambulance services that still exist or are managing to survive, that ambulance service is a huge part of their identity. It represents who they are within the community. It represents a huge part of their life and what it means to be a member of that particular town. And so when you begin to have when a volunteer EMT or paramedic looks and sees that the ambulance service as it exists today probably is not sustainable and probably won't be there tomorrow, that's a very difficult That's a very difficult thing to confront. So, you know, there's a sense in which we see communities going through the 7 stages of grieving as it relates to the loss of an ambulance service.
Yeah.
And so, figuring out where you are within that in that 7 stages is kind of important for a community. But remember that down towards step number 6, or depending on which model you look at, that's when you begin the testing, and you start saying, well, what are the new options that might be available to me? And that's where you begin to see hope emerge, and then you start to build something new. And yeah, I think that there are a lot of models. Communities are finding that as they look at collaboration and different funding models. You know, it's true that in many small communities, I don't think that ambulance services are going to continue to exist the way that they did today. But that doesn't mean that there won't be EMS around, or that there are no other options. We just have to get deliberate, and we have to get smart about it.
Absolutely. Talk about deliberate and smart, Andy. We have spent almost 30 minutes with you on this, so we're going to start to wrap up just a little bit. Beth, if you go to the next slide, I want to get Andy talking about resources, share a couple of things. We've listed on this slide for all of you some resources that we think are really important. Certainly our partners at the Technical Assistance Services Center, you know them as TASC, have been engaged in rural EMS and the collaboration between state flex programs, critical access hospitals, state EMS officials, and rural communities. Posted up on the chat is a collaboration toolkit that came from the Technical Assistance Center, and we're proud to have them as a partner. Certainly we hope that you know about the work of your state offices of rural health. There's one in every state in the nation. They're all different. They all have different strategies for addressing rural health needs based on the needs in their state, but they need to know about your interests and your issues and your models for EMS. So please be in touch with your state office of rural health if you're not already. We plan, I think Andy mentioned very quickly, along with the National Association of State EMS Officials, our other partners, including the National Rural Health Resource Center, TASC, the National Rural Health Association, and many others, plan a National Rural EMS Conference. So I'd like you to watch for information about them in the spring of 2019. We'll be in South Carolina. We've already talked a little bit about the EMS tactical agenda for the future. It is expected to be released early next year, if not before then, so we hope that you'll watch for that. And then we have a web page where we've compiled some EMS resources from our conferences, from other toolkits, and from our partners into a spot where for state offices of rural health and their partners. Andy, I know that there are many rich resources through NSEMSO and others. What else should we mention to folks if they want to learn more about EMS and to find resources for that? Where else can we point them? Are there thoughts for that?
Yeah, so I sent a link to the draft JC work plan, which you can get off of the NSEMSO website. But if you go there under the Rural Committee, you can find some other resources and information about that. And I also put links to the Rural Health Information Hub. We kind of mentioned them, but just put that link in there in case people wanted to go there. And then the other thing that anyone should feel welcome to do is my email is included in there. It's just simply andy.gienap@wyo.gov. I put that in the chat window. I know we're trying to wrap this up, but feel free to shoot me any questions or whatever I can do to help. I can usually connect people with different stuff. So.
Yep, you're great at that. Next slide, Beth. Thank you, Andy. You've really given us a lot to think about in just a short bit of 30 minutes. As we said before, we want to thank all of you again for joining us. Survey is going to pop up in a minute to ask you to make comments, ask for resources, and evaluate our talk today. We'd like that you please fill out that survey. Also, we want to encourage you to keep in touch with us to learn more about the Power of Rural movement, and the best way to do that is through taking the pledge to educate, innovate, communicate, and collaborate. And you'll find that on the Power of Rural website. And then finally, as we're closing this out and we're beginning to wrap up our National Rural Health Day, if you take a look at the next slide, we have published, with the help of our friends and our colleagues at Impact Communication, a compilation of stories of rural people, community stars, organizations who are working to improve rural health around the country. And many of these stories are about people who are working in EMS, and they are inspiring. They are compelling stories. And as Andy said, we all have to do better as leaders to tell a compelling story. So we want to thank all of you. We want to thank Andy for his good work, not just today, but every day and throughout the year. And I wish you all a happy National Rural Health Day. Thank you.
Thank you, Terrell.
Welcome. Bye,
Thanks, Andy.
All right.